Happy New Year, everyone, and welcome to our January 2020 Marketing Tip of the Month. This is Maureen Maher. You know me, I'm the Educational Director and founder of the Center for Continuing Education of Osteopathy. And for those of you who know me and know my continuing education courses, know that I am all about positioning yourself as an expert and as a specialist within the field of osteopathy and manual therapy. The courses that I teach all address specific patient populations, and I've distinguished myself as somebody who deals with specific patient populations, as opposed to the first 10 years of my career that I spent as a generalist practitioner, which was a fantastic foundation. But I think that for those of you who want to stand out, and for those of you who want to perhaps go deeper within a specific field, specializing and distinguishing yourself from your peers can actually be a really great way to build your reputation and to build your practice, especially if you're in an area, a city, or a country where osteopathy is already quite and relatively saturated, and you're trying to find a way for you to stand out and build your patient list. You might also be in a clinic where there are several osteopaths. You might be new to that team, or you might be in solo practice or smaller practice, and you're saying to yourself, okay, how can I get out there and make a name for myself, not just fill up my list with all of these crazy marketing schemes that everybody seems to have on the internet these days, but actually through credibility, a solid reputation based on your credibility as a practitioner. This is what I advocate, and these are the types of marketing techniques that I try to give you. So it's based on, what you actually bring to the table as a solid, competent, talented, and knowledgeable practitioner, not just, your strategy for funneling people, through the door. So in the spirit of a series of pediatric workshops that I have coming up in Toronto, for those of you who can make it to Toronto this spring, and of course our pediatric online course for those of you who can't make it there in person, coming up at the end of the month, I wanted to talk to you about ways that you can go about distinguishing yourself as a pediatric osteopath, if that's something that you're studying with me at the moment or something that you might be considering doing. So I often draw from my own experience. I find that that's the best way to be able to tell people what I've found, has led to my success and what is pretty much a waste of time. I've always been the type of practitioner who liked to work with quality versus quantity. So I've set myself up in a way whereby I attract what we call destination shoppers, meaning patients that are looking for a specific osteopath with a specific skill set who can resolve a specific problem. As a result, I see less patients, I spend more time with the patients that I do, and my fee schedule reflects that. So I don't fit in with the usual fee schedule or treatment duration of most other practitioners. But on the other hand, I don't want to compete with everyone else. I want to stand out differently, and I want to be able to offer knowledge, not just a competent treatment. So for those of you who practice in countries where you work on the 30-minute model, where it's high volume, considering taking more time during your initial assessment of a newborn and taking the time with parents in order to be able to educate them and not just give a treatment and next have them out the door quickly is actually the model that a lot of, not just male, but some female a lot of female practitioners that I know throughout the world who've gone on to specialize in pediatric osteopathy. So when you set yourself up as a specialist, know that, let's say within the medical community, you might go to a walk-in clinic and there might be a lot of generalist doctors seeing a lot of general cases, and you're in and out quickly. It's not in depth. It's not a long follow through. It's not the same as your family doctor, and it's certainly not the same thing as a specialist. So if you think of in the medical community, when you're going to see a specialist, people are coming with a specific problem. They're coming in for an in-depth consultation. They're looking for a solution to that particular problem. And they expect that the way that you manage your practice, if you are a specialist physician, is going to be different than somebody who works, let's say, in a walk-in clinic. So it's the same thing with your private practice. You might need to set up your schedule differently, your fee schedule differently. My fee schedule for seeing a newborn, even though there are other practitioners in my area who do also treat pediatrics, my fee schedule for treating pediatrics is about 30% proportionally more than most others. Now, why is that? Because I've been doing it for 15 years. because I wrote my thesis in the field of cranial osteopathy, which led to my specialization in pediatrics. Because as you know, there's a lot of conditions within pediatrics other than the general orthopedic ones that need to be resolved through the cranium, or the cranium is at least an integral part of your treatment. And for those of you who say you don't need it, well, they're just lying. It's a way for them to help you bypass cranial treatment, cranial training, in order for you to be able to practice pediatrics. But that's another subject. I take issue with people who want to try to give you a quick and easy education. And that's why my course, my online course, is a 10-week course, and my live courses are also spread out over, 10 different sessions, because there's a lot to be able to cover, and cranial is a good part of it. But I digress. When I set up my practice, like I said, my consultation and intake takes longer. So I actually reserve a full hour. And for those of you in parts of the world where half hours is standard, you're going to think that an hour is a lot. I know. But if you were to go in and take a look at some of the subjects that we cover in the course that I teach, you'll see that being able to do a proper assessment of a newborn, and not just treating, is really important in order to be able to take the approach and help the patients, the parents that is, be confident in your knowledge and skill. So, for example, I was chatting with somebody. I get people that reach out to me through a mom's group on Facebook. And she had a newborn who had, or not, a 5-month-old, who had fallen, bumped his head, among other things. She had brought him to emergency. They had sent him home saying he was fine. But 2 days later, he was crying like crazy because he had a bump on his head and he had a hematoma. So I said to her, do they do cranial testing, cranial nerve testing? There's nerves in the face, and those are things that they test to make sure that he doesn't have a concussion, even at 5 months old. No, they didn't do that. Okay, but I'm bringing my child back to the hospital. So I ended up guiding her and doing a bit of hand-holding with her through Facebook chat as she was in the car with her husband, going back to the emergency for a second time with her child and saying, it's good that you're having him checked as a follow-up. Make sure that they do full cranial nerve testing. Make sure that they do a full assessment of him as a newborn. And if they say they didn't find anything, then don't worry. If they send you home, it'll be fine. And if you want a follow-up with me to make sure that, from a structural standpoint, his neck wasn't affected, there isn't a cervical problem or even his lower limbs because he had fallen in some unusual way on his legs, apparently, I can have a follow-up with him, within the next week as well. Once he gets this, the stamp of approval that he's fine from an emergency standpoint at the hospital. So being able to, offer this level of skill and knowledge, saying that, I can be there for you when you have an emergency with your child because I know how to assess them. I know how to do a full intake and I know how to do a full discharge. And if need be, I know how to refer you to other specialists, and building your network of other specialists is another subject we'll cover on another time. But being able to have that knowledge and skill is what rounds out the consultation. Because any of you who have ever treated newborns know that it's not just the treatment of the newborn. The treatment of the newborn itself might take, 10 minutes. You can do a 20-minute treatment if you're having a really, really lucky session that the newborn cooperates for up to 20 minutes. That's the maximum I'm ever able to do. And so a lot of that is a lot of hand-holding and a lot of educating the mother. So taking extra time to be able to do that builds your reputation with the mother, establishes your reputation as somebody who is knowledgeable, and calms the mother so that she's going to feel confident in coming back to you for further follow-ups and following a protocol with the child if need be. If, for example, the child is in need of a cranial molding series of treatments, understanding why she needs to bring her child in a couple times a week, at a specific interval over the next few weeks and months, in order to avoid having to have the child wear an orthopedic helmet, you need to build a solid relationship with that parent first. So distinguishing yourself with regards to the duration of your appointments for initial intakes with new babies, and also your pricing is going to reflect that. So setting yourself apart and not being afraid to set yourself apart in a way where your fees are higher, where your intake is longer, where your assessment of a newborn is very complete And that's one of the things that I provide in the online course is, sheets, assessment sheets that you can use, everything that you can just download and print off and use right there in your practice, so that when the child comes in, you're doing a full cranial assessment, cranial nerve assessment, developmental milestones assessment, and a full body osteopathic assessment. That alone, like other specialists who work, with kinesiology conditions or muscle conditioning conditions, specialists that I know, their initial intake is a full evaluation. So if you put that up on your website, explain all of the steps that you go through when you do an intake with a newborn, that you're doing full cranial nerve testing, that you're assessing developmental milestone achievement, that you're doing a full 8-step, pediatric osteopathy, full body assessment, and then a treatment from there. Mothers are going to go, wow, that's really complete. Now I understand why you take up to an hour. Now I understand why you charge, whatever it might be. I mean, I charge over $100, in cities where we charge for an adult initial assessment and intake about 140 Canadian dollars. I charge anywhere between 100 and 120 for pediatric. Now, when they're coming in for follow-up treatments, assuming I don't have to do a whole lot of re-educating all over again, and remember that with newborns, there's a lot of time of undressing them, consulting with the parent, doing the treatment, explaining what you found, follow up again. It's really a 3-way dynamic often between you, the newborn infant, and the mother. So it's really tough to get them in and out the door within 20 minutes unless you have a separate room, or multiple treatment rooms whereby you have an assistant or a nurse practitioner who can bring the mother in with the child, undress them, prep them, and you just pop in, do the treatment, a quick consult and leave. Many of us don't have that kind of setup, so it ends up taking a little bit more time. That being said, I find that if I invest that initial time at the beginning, part of that first hour that I take with a mother for a pediatric case is to explain to them that now that I've explained everything to them, subsequent treatments are going to be half-hour appointments. The treatment itself is going to be 10 to 20 minutes maximum. But we're not going to have time to do a full review like I did with you today. If you want to do a full review, what we can do is plan, let's say that you need to do a series of treatments for, cranial molding as an example. Okay, we did a treatment today. Let's book over the next 2 weeks, 4 subsequent half-hour treatments. And then after that, if you want to have a consultation with me, not just pop in for the treatment and leave, then book that and then we will reassess. And when you book that, you book a longer appointment once again, so that you have the distinction between when mothers want to be able to consult with you, and that would be your longer appointment of, 45 minutes or an hour, depending on how quickly you want to work. But in between, when you're doing just treatments, okay, and I've done the treatment, great, come back again. And that's usually when you're doing cranial molding, whereby that you're working with them, a series of possibly up to 10 treatments over a more mid to long-term, period. You don't want to be sitting and chatting and having to re-explain and reassess with the mother every single appointment. And know that, the same way that babies are, energy vampires and just big black holes of suck of need to their mother, the mother also, from a psychological, emotional, informational, and energetic perspective, is also extremely needy of reassurance, needy of information from you, need of, okay, so how does he look today versus last session, doc? And, how does he look versus last week? All of this can take time and eat up into your scheduling time. So you have to be able to let the mother know that you're there for them, but also, and take the time initially, but also control their access to you in subsequent sessions, so that you're not doing a full, reassessment with the mother and with the child every single time. That'll allow you to be able to establish yourself as a professional, somebody who's specialized in that first initial intake. Plan with her. Plan in advance, just like a personal trainer. Okay, we're going to do 6 sessions and then we're going to reassess. So in those 6 sessions, I'm not going to have time to sit and talk with you. You're coming in for half an hour, you're out. And if you want, let's say we'll do 3 or 4 or 5 treatments, and then we'll plan another 45 minutes or hour. We'll book that. It's a separate appointment duration, so that I can sit down with you and take the time to reassess. This is the way that I found over the years works well with my schedule, is allowed me to be able to position myself as an expert within my field. I'm not afraid to distinguish myself from my peers who might charge even up to half what I do for the initial intake with a parent, with a newborn, that is. And I've always said that, if a person has specialized skills, why are they not charging more? Within any medical system, does a specialist not make more money than a general family practitioner? Of course he does. So it's the same thing. If you're offering specialized knowledge and specialized skills, and the time and energy that you might invest in taking our pediatrics course definitely will have you coming out being able to distinguish yourself from the rest of the osteopathic crowd. And so as a result, of course, your treatments should cost more. When I first started practicing years ago, I had a specialization in cranial osteopathy more than most because I chose a college that put more hours in their curriculum into that, as opposed to in some countries where cranial osteopathy is not taught at all. And I also did my thesis in that field, so I came away from day one graduating, having a solid basis of what I would be able to do with newborns. And I used to charge, I think, less. There's the idea, the concept of, a body, a baby, they're smaller, the sessions take less time, the fee schedule should be less for a newborn. Well, over the years, I came to realize that I had knowledge far beyond most people. I took more time with the parents to answer their questions, was able to answer their questions in ways that no one else could, and that knowledge had value. And if I was going to allow my clients to, suck me dry, so to speak, in terms of asking so many questions and me being able to answer them and take the time to, that's a consultation. That's not just a treatment, and that's knowledge, and knowledge costs. When you have a consultation with a lawyer, it costs a fortune per hour in order to be able to have access to their knowledge. So if you're taking time with a mother, with a newborn, whereby you're answering a lot of their questions, and if you've educated yourself properly, you should be able to, this will help build your solid foundation, a good rapport and relationship of trust with the mother to bring them in for subsequent treatments. I find that when I do this, mothers say, okay, like when's the next follow-up? It's not a question of I'll see how I feel, right? If I have a client who says, I know that they've got a chronic condition, I know they need a follow-up, and they say, I'll see how I feel after today, I almost feel like saying something like, why did you waste my time? And that's usually a person who's just not committed to getting better, or just has a trust issue from the very beginning. And so mothers very naturally do have trust issues when it comes to who they're going to allow to touch their child and whether or not they're going to be able to help them. So investing that time initially in order to build that bond of trust with the mother, and in order to be able to do that, you've got to take more time. If you're going to take more time, you have to charge more. You might find that you might have a little bit, sometimes I've had some students also tell me that they work in a clinic where, changing the duration of their appointments or their fee schedule, goes against the grain of the way things are established within their clinic. Maybe they have an online system whereby they don't have the freedom to play around as easily, from a programming viewpoint with the duration and the cost. And so, it's always so much easier to just tell everybody, just, follow what we do. Right? And so sometimes I've had some students whereby once they grew in the courses that they took with me and expanded their skill, they found that in order to be able to set up their practice properly, they had to make changes within the clinic, and sometimes the clinic was not supporting them in those changes. So then you find yourself facing the decision about whether or not, as you need to grow, kind of almost like some relationships, can I grow within this relationship? Is there ways for me to sit down with the owners of the clinic and my peers or whoever, has an effect on these decisions and be able to, negotiate with them and navigate a way for me to be able to grow professionally, reestablish my fee structure and my consultation duration? And will they allow me to do that, and will they support me in it? So I'm not going to tell people in order to be able to grow professionally, you have to leave where you are. That's a decision that you have to make, and I'm not trying to suggest it. I'm just saying that if you're facing that, if you're facing some resistance, or if you do face some resistance in the future after you finished a course with me, know that you're not alone. You're not the only person to whom it happens. And just like in some relationships, sometimes when you want to grow and you need to grow and become a better person, so you're becoming a better osteopath, more skilled, standing out from the competition, you might encounter some professional jealousy. You might encounter some resistance within your colleagues and within your clinic. And then sometimes you might find yourself facing decisions that you have to make with regards to whether or not your current work setting works for you. And I'm going to leave that with you today. That's our tip of the week. I've been talking for a good 20 minutes. I always try to make these videos, these audio files short, but I feel like I've got a lot to share. In my online courses, what I teach, most of it is very technical, everything that you need to learn as a practitioner. But I get a lot of practitioners write to me and ask me, all of these other questions. And sometimes even when I'm teaching classes live, when I have a few extra minutes, I try to get into this type of stuff. And, everybody's eyes and ears perk up. People want this type of advice. So that's why I've decided to start doing these monthly little podcasts, audio casts. And I apologize for the fact that they are audio and not video. For me to be able to make a video like this, I've got to do a lot of setup. And I actually find that when it comes to thinking and brainstorming, I actually do a better job when I'm able to just talk and not worry about whether I'm looking into the camera. So when I need to demonstrate something, or when I really feel like, getting my face out there is important, then I'll make a video. But you're going to find that these monthly marketing tips that I'm going to share with you are mostly going to be in audio format. The good thing about it is that you can pop, a microphone into your ear, an earphone that is, an earbud, and listen to what I'm talking about, either over and over or while you're driving or anytime. You don't have to be watching. It's just as if we're having a phone conversation. So I hope that works for you, because that's really the best way for it to work for me, for it to flow without feeling like it's taking up a lot of my time and draining you. And draining me, and also I'm giving this to you for free, so I've got to make it cost efficient with my time and expenses. On that note, if you have any questions about the upcoming pediatric online course, we offer it on a regular basis. It's starting at the end of this month. It's a 10-week online course, one chapter released each week. There's a lot of downloads. You can download and keep the workbook at the end. The workbook is a desktop version. It's not a printable version. We have to do that in order to prevent a lot of copyright infringement, which unfortunately takes place in this digital world of ours. But there are a lot of downloads that you can extract from the workbook, worksheets, all of the assessment sheets that you might use, the protocols for each type of condition, whether that be torticollis, whether that be digestive difficulties, latching or feeding, upper limb dysfunctions, lower limb dysfunctions. So most of what's in the workbook is in downloadable format, designed as forms that you can just grab and use whenever you've got a different type of child that comes in. Oh, this is a lower limb issue. Okay, let me grab another copy of that protocol that she gave us. So there's a lot of stuff that you can take away from the course that you can keep for later on. You have access to the course for a full year, even though if you want to complete the course and receive your certification, you have to follow through the course and submit all of your homework, preferably week by week, so I see that there's some progress. And all of the homework assignments have to be submitted within a month after the last date, which is 10 weeks after the course starts, because it's a 10-week course, one chapter per week. The corresponding chapters will be offered as one-day workshops in Toronto starting at the end of March, with 2 workshops per weekend per month. So that's actually spread out over 8 workshops. I've just structured it a little bit differently. Over 8 workshops over 4 months. If you can pop into Toronto for 1 or 2 of the workshops, if you can't travel to Toronto or if you're not there regularly to be able to attend all of them, if you're already practicing a little bit and you'd like to attend, just the one on latching and feeding, or just the one on lower limb, or just the one on plagiocephaly, you can do that too, provided you already have a solid background as an osteopathic practitioner and some knowledge of cranial osteopathy. So wishing you a great month of January. Any questions that are not too technical, especially if you're not already enrolled in the course, you're welcome to write to me. Our email address is ceosteopathy@gmail.com. C for continuing, E for education, osteopathy with a Y @gmail.com. This is Maureen Maher, educational practitioner, Center for Continuing Education of Osteopathy, signing off. And also our online platform is ceosteopathy.thinkific, as in terrific, but thinkific.com. Have a great day.